While I just now mentioned that we do community outreaches, so I started off my work in India doing community outreaches, but in one of the outreaches in a very rural village in Assam in India, after my session, one of the girls came to me and said, "Why didn't you come to my village last year? My mother just died," and she was only 18-year-old and her mom was only 40 or 42-year-old, because she didn't know that a painless lump in the breast could be cancer, and she didn't want to discuss with anyone because of the shyness. So I told her that I couldn't save your mom, but no other moms will die from your village. So we started to go deeper. So this poster that we presented was from our work from February 2020 through April 2024. So we went door to door to do the breast cancer screening, and as in screening we mean the breast self-examination. We were teaching all the members of the household, and how we did it was with our team. So I made the team, created the team from the villagers themselves, like village girls who we trained in the local hospitals, and they became the role model for the villagers themselves. And there was a trust because the villagers could trust them because they were their own people. Now when we went, so this poster is all about like how we did the door-to-door screening, and while doing that, we realized that, and we screened actually during that time period 22,278 village residents, and it included both men and women because we do not discriminate. But the most importantly is, even what we felt was that even when we mentioned to them, maybe you have a lump in your breast, they did not care because food was their priority, and most importantly, who would take them to the hospital, because these hospitals are in a far-flung places where these villages are very remote. So we had to improvise at every step. So we decided that, okay, we have to generate the healthcare certificate, because from the government of India, we have to have a health card where we get the subsidized treatment or free treatment, but it has to be diagnosed after diagnosis. So and the villagers didn't even know that. So we generated the income certificate. We took the patients to the hospital. We stayed with them throughout the process, communication with the doctor, and all the additional charges, starting from the transport to the fees, at whatever amount we have to pay, because it's not everything is free. Everything we cover. On top of that, we give them food in the process, bring them back home, and follow up with them, like on the day of the treatment, they have to go back to the hospital again. So this holistic approach that we have taken, and also it's not just about the patient, the full care, family also, like counseling, support system, teaching them how to do exercises, everything in a holistic way we manage. And so since our penetration and screening, no more late detection, where the villagers didn't even know what cancer was, now they're so proactive and they're so informed, and most importantly, we are able to save lives in the untapped sectors who could have totally gone undiagnosed.